Halitosis can be treated through a combination of lifestyle modifications and dental treatments, including improved oral hygiene. Brush your teeth at least twice a day using fluoride toothpaste and floss daily to remove food particles and plaque between teeth. Replace your toothbrush every 3-4 months. Clean your tongue. Use a tongue scraper or brush to clean the surface of your tongue, as bacteria can accumulate on the tongue and contribute to bad breath. Regular dental checkups. Visit your dentist at least twice yearly for professional cleanings and oral examinations. Your dentist can identify any dental issues contributing to bad breath and recommend appropriate treatments. Drink water. Staying hydrated helps to maintain saliva production, which naturally cleanses the mouth and reduces bad breath. Mouthwash. Use an antibacterial or anti-plaque mouthwash to help reduce bacterial growth in the mouth. Quit smoking. Smoking can contribute to bad breath, dry mouth, and other dental and health problems. Address underlying issues. If your bad breath persists despite good oral hygiene practices, consult your dentist or doctor to identify any underlying medical conditions, such as sinus infections, gastrointestinal issues, or diabetes, that might contribute to halitosis. It is important to note that treatments for halitosis may vary depending on the specific cause. Sometimes, a combination of approaches may be necessary to manage bad breath effectively.